Bismillahirrahmanirrahim. The cranial nerves present on the inferior surface of the brain. This is the olfactory nerve, the olfactory tract, and this is the olfactory bulb. The olfactory bulb, the olfactory tract, and this is the optic nerve, or optic nerve, and it continues as the optic tract. This is the optic chiasm, and this is the optic tract. Optic tract, and this nerve over here is the trochlear nerve. The trochlear nerve. The abducens nerve. Abducent nerve. These two nerves we've got two nerves over here. Medially we've got the facial nerve. This is the facial nerve, and laterally we've got the vestibulocochlear nerve. The vestibulocochlear nerve. Here we have at the junction of the medulla and pons, we've got this nerve, the hypoglossal nerve. The hypoglossal nerve, and laterally we've got the vagus nerve. Vagus nerve, and in this region it's not present in the model, but it should have a glossopharyngeal nerve. And these are the ventral roots of the first spinal nerve. Ventral roots of the first spinal nerve. The midbrain. The midbrain, the pons, the middle cerebellar peduncle, and the pyramids, the olives, and along with the mammillary bodies. Yeah, the mammillary bodies. To be continued. Full of mistakes, demonstration of the cerebrum, because this model is not perfect again. So structures that can be identified, we got the central sulcus, of course. In front of the central sulcus you've got the precentral gyrus along with the precentral sulcus, the postcentral gyrus along with the postcentral sulcus. The frontal lobe is divided into three gyri. You got the superior frontal gyrus, the middle frontal gyrus, and the inferior frontal gyrus. We also got sulci. We got the superior frontal sulcus and the inferior frontal sulcus.
Please, Hamza, can I ask only one question? Please show me the difference between the sulcus and a gyrus.
Okay, actually a sulcus is a depression. Okay, sulcus is when the brain substance, it goes inside. Yeah, inside, and it takes a turn back upwards. So yeah, and when it takes a turn backwards, it forms an elevation. That elevation is the gyrus. Okay, see. So these elevations, these upward elevations of the brain substance, these are all gyri, and the small depressions between two gyri are the sulci. Okay. So we've got this lateral sulcus. The video video.
You are saying it. That's impossible for me.
داوني سنتو ايش دلتا شي دا بورا بقيت تاريخ ها
اوكي
دلتا راش دلتا We got the lateral sulcus, also known as the Sylvian fissure. And we got the lateral sulcus is divided into the anterior ramus, the posterior ramus, and the ascending ramus.
Where are these rami, please? For a second.
Yeah, the ascending ramus, the posterior ramus, and the
Of which structure these ramus belong to?
and the ascending ramus. And so anterior, posterior, ascending. They belong to the lateral sulcus.
Lateral sulcus. Okay. Actually, these are extensions of the lateral sulcus.
Yeah.
These are mine.
This is the superior temporal gyrus, the middle temporal gyrus, inferior temporal gyrus. This model is not anatomically perfect. Superior temporal gyrus, middle temporal gyrus, inferior temporal gyrus, along with their sulci. And the superior temporal gyrus, as it goes upward, it forms this gyrus known as the supramarginal gyrus. And just adjacent to the supramarginal gyrus, we've got the angular gyrus. Okay. Here we have a Calcareon sulcus. The Calcareon sulcus, and this is the pre-occipital notch. The pre-occipital notch. The parieto-occipital sulcus should be over here. The parieto-occipital sulcus should be in this region. Now the medial side. Medially we've got the corpus callosum. This is the corpus callosum. The corpus callosum has got this the genu of the corpus callosum.
The genu of the corpus callosum, I think it's the anterior part of the corpus callosum.
Yeah, this is the rostrum of the corpus callosum, which extends outwards. The rostrum of the corpus callosum, the genu of the corpus callosum, the trunk of the corpus callosum, and the splenium of the corpus callosum. Yeah, the splenium of the corpus callosum, and this structure is the fornix.
Okay. Oh yes, that's the fornix. And just superior to the corpus callosum, as I think Singlet Gyrus it is.
Yeah, what?
Singlet Gyrus, just superior to the corpus callosum.
Where is the Singlet Gyrus?
Just superior to.
Oh yeah, just superior to the corpus callosum. Very good, Tayya Papain. We've got the Singlet Gyrus.
That's very prominent, guys.
It's a very prominent gyrus. It is. And then I don't think we have any other identifiable. Yeah, cuneus. This structure over here can be the cuneus, the Calcareon sulcus from the medial side over here, and the lingual gyrus. The lingual gyrus. The Calcareon sulcus can be over here. The cuneus can be over here, and the isthmus of the Singlet Gyrus. So that's it.
That's the medial aspect of the cerebellum.
Yeah, thank you.
Explain.
Okay.
Bismillahirrahmanirrahim. The model demonstration of the cerebellum, the fourth ventricle, along with some structures of the brainstem and a few structures related to the limbic system and the ventricles. So we'll start with the first structure, and that is this whole whitish substance represents the thalamus. And this bulge is known as the interthalamic adhesion. This is the pineal body, and this vein probably represents the great cerebral vein. Okay. This is the body of the fornix. Fornix is a part of the limbic system, and here I think only the body of the fornix is visible in this model. So this is the body of the fornix. The thalamus is actually present in the third ventricle. So in this region you will find the third ventricle, and here just anterior to the thalamus, you will find the foramen of Monroe. Foramen of Monroe. Foramen of Monroe.
Explain the reddish thing which is doing here.
Wait. Um, the anterior commissure. Yeah, this is the anterior commissure. The lamina terminalis.
Please, you can pause the video for some time.
The pons. The medulla oblongata. The fourth ventricle should be over here. The fourth ventricle, which continues upwards as the cerebral peduncle. The cerebral peduncle. And this region represents the tectal or quadrigeminal plate. The tectal or quadrigeminal plate, where you will find the superior colliculi and the inferior colliculi. And this region represents the hypothalamic sulcus. And that's it for the model. I think we have one structure remaining. This can be the pituitary gland. No, not the pituitary gland, sorry. There is structure there. The marking there.
Pons da passa, né?
No,
Pons da passa, o delta.
there is structure. Da.
Pons sara juh dare हम लोग हो रहे हैं.
No,
Pituitary gland है कनो.
Listen, wait.
Pineal body. एक colliculi है.
No, I got it. Push him. Optic nerve देखा ना? No, optic nerve sara makhamak sara daga body, mammillary body. Yeah, yes, got it. This is the mammillary body, okay? The mammillary body. Thank you. Bismillahirrahmanirrahim. The model demonstration of the cerebellum. We've got both the hemispheres, right one and the left one. It's not anatomically perfect, so we've got some structures that are not identifiable, but those structures that are identifiable, we have got the vermis. Yeah, this meeting point of the book of both hemispheres is the vermis. And this whole region represents the peduncles, the superior, middle, and inferior peduncles. This region, most medial region, represents the superior peduncle. Most lateral region represents the middle peduncle, and inferiorly we have got the inferior peduncle. So the superior peduncle, the middle peduncle, the inferior peduncle. We have got the flocculonodular lobe, this one, flocculonodular lobe, the tonsil, this is the tonsil, okay. Now we got the posterior lobe. This region represents the posterior lobe whole, and this is the anterior lobe, okay. And this fissure represents the fissure. This fissure represents the horizontal fissure. The horizontal
and posterior.
Between the flocculonodular lobe and the posterior lobe, you got the horizontal fissure, and this fissure it's given the name as the dorsolateral or posterolateral fissure. The posterolateral fissure, okay. And in this region we've got the superior medullary velum here. Superior medullary velum. From inside you'll find it over here. Say superior medullary velum, and inferiorly we've got the inferior medullary velum over here. The inferior medullary velum. Superior medullary velum, inferior medullary velum. And when you join these two together, you'll find the anterior cerebellar notch. You'll find the posterior cerebellar notch. So these are some of the structures that are easily identifiable on this model. Model demonstration of the cerebellum. This is the anterior lobe of the cerebellum. The anterior lobe. This is the posterior lobe, largest lobe. The posterior lobe of the cerebellum. Present in their anatomical positions. Okay, this is the primary fissure. The primary fissure. And this is the horizontal fissure. The horizontal fissure. And if you join them together, so here you'll find the vermis. The vermis. Okay. Now posteriorly we've got this is the tonsil. The tonsil of the cerebellum. And this is the middle cerebellar peduncle. The middle cerebellar peduncle. Here you'll find the nodule, and this is the flocculus. The flocculus of the cerebellum. And these white fibers represent the white matter of the cerebellum, and they are collectively known as the arbor vitae. A-R-B-R, arbor means tree, vitae means life, V-I-T-A-I, arbor vitae, tree of life. And in the transverse section, this is the uvula of the cerebellum, also over here, and this is the pyramid of the cerebellum.